Thank you. Good morning.
Good morning. So you have the floor now.
Thank you. Good morning, viewers, and welcome to another edition of Kakaki Awareness with Dr. Denise Ejo, the CEO of Commode Cancer Foundation, in partnership with AIT. Today, we're going to be talking about sarcomas. I'm sure a lot of people would have heard the word and at some point in their life not realized what it is. It is apparently some form of cancer. And so we'll be learning about the facts and myths and see what we can get. And we've got a guest in the house, Dr. Habib. Dr. Habib, good morning.
Good
Can you
morning.
hear me? You can.
Thank you.
We can see you very clearly. So now I've got to make sure I can hear you. All right, awesome. So what are sarcomas? Sarcoma Awareness Month. That is what month are we? July is Sarcoma Awareness Month. So sarcomas are uncommon cancers that can affect any part of your body. A key symptom of sarcoma is a lump that gets bigger quickly. Most people get diagnosed when their sarcomas is about the size of a baked beans. A baked beans tin is a tin like this, so please don't think. So it must be big for you to know. And this month, today actually, is World Head and Neck Cancer Day, 27th of July. So let's remember friends, family, relatives, and cancer patients all around the world, all around Nigeria, who are going through head and neck cancer, and help them to celebrate another day, another year, another opportunity, another time to say, well, I am still here, and to keep fighting the fight. We will get there. Together we fight, together we will win. Cancer is real, but we can beat it. So let's know what we're doing. So let's start this conversation with Dr. Habib. Once again, it's Commode Cancer Foundation. Who is our guest? Dr. Habib. Dr. Habib is the head of oncology at the NSIA Luth Cancer Center. His areas of research interest are prostate cancer, breast cancer, colorectal cancers, and head and neck cancers. You see, it's so nice for me because he's head and neck, and today is head and neck. We're celebrating head and neck cancers and rare cancers like sarcomas. He is the fellow of the West African College of Surgeons, Radiology, and a member of the Association of Radiation and Clinical Oncologists in Nigeria, ARCON, the American Society of Clinical Oncologists, ASCO, and the Quality Assurance Team for Radiation Oncology in Nigeria, QUATRO. Wow, Doc, you medical people, you give me a lot of homework when I have to speak and align with you. Good morning, and thank you for joining me this morning.
Good morning.
Are we ready to go? Let's talk about sarcomas. I always learn a lot, and I always make people understand I'm not a medic. So whenever we're talking about cancers, I always need you guys to talk about it. Thank you. So let's go with the very first, very basic question that everybody wants to know. What is sarcoma? And what is the main cause of sarcoma?
Okay, so sarcomas are connective tissue cancer. That's the cancer of the connective tissue. When we talk about connective tissue, we are talking about bone, we are talking about muscles, we are talking about blood, any of the part of the body that connects the viscera. The viscera are the organs like the liver, the lungs, the kidney. So any other organ, any other part of the body that is not an organ comes under the classification of connective tissue. So connective tissue malignancy is called sarcoma. Basically, sarcoma can be divided into two types. We have the bony sarcoma, which we always refer to as osteosarcoma, which has other categories. Then we also have soft tissue sarcoma, which also have various other categories. Now, sarcoma are not uncommon, even though they are not very common, but they are. If anybody has been to a sarcoma clinic, you see the number of people that have sarcoma. So it's even though it's rare compared to other malignancies like breast cancer, like prostate cancer, cervical cancer, but it's not too rare because we still see them. Because most of the time we cannot pinpoint what is causing sarcoma. However, we have some factors that can increase the risk. For example, a few number of, a low percentage of sarcoma is as a result of genetic malformation. That's as a result of syndromes, something like neurofibromatosis. We also have like familial adenomatosis, polyposis coli, a few syndromes like that, especially that has to do with disability of the genes that is able to control cancer cell, P53 gene we call it. However, other factors which are environmental that can increase the risk of sarcoma are exposure to ionizing radiation, like the ultraviolet radiation from the sun or ionizing radiation from factories, exposure to chemical pollutants like the exhaust from car, exhaust from generator fumes, exhaust from factory. Like we know, almost every house now will have 1, 2, or 3 generator because you'll be sharing it with neighbors. And most of the time we're also in the traffic, inhaling exhaust from the car. Alcohol and cigarette can also increase the risk of sarcoma. So excessive intake of alcohol, cigarette smoking, this can influence sarcoma. Any condition that can result in low reduction of immunity, that's immune deficiency, can also predispose to sarcoma. For example, HIV, organ transplant. When we do organ transplant, you give drugs that reduce immunity. This also predisposes to sarcoma. Even the cancer treatment, chemotherapy, radiotherapy can predispose to sarcoma. But usually this predisposition will come several decades after the use of radiation therapy or chemotherapy, which most often does not occur because most of the patients they come late and they don't live long enough. And even when it will occur, it's in a small percentage. It's not all the patients that receive the therapy. So it's not something we should worry too much about and say you don't want to take treatment because of risk of sarcoma. So these are just the few things that usually will result in sarcoma.
Thank you. I'm going to remind you of something because it's something that is very interesting for me. When we're growing up, a lot of us that grew up in Nigeria, we remember that we used to watch people that would carry children on their back or in the sun, we would use umbrellas. And all of a sudden, we're now doing fashion. We don't even remember that we need to cover our head. Now you've just highlighted something and I'm thinking, oh, wow. Could that be one of the causes of sarcoma? Let's continue this conversation. But I'm just throwing something that you just said that made me realize that, oh, so those people in those days, our parents and grandparents used to do this. Was that why? Okay, can it be cured though? And can you summarize what the treatment options are? Because one of the biggest challenges we find is people are afraid of treatment. And one key treatment is chemo.
Yeah. Yes. Can it be cured? Yes. Sarcoma, like I said, there are a lot of varieties. It's not just one disease. So we have sarcoma with different grades. When I talk of grades is a word for degree of aggression or aggressiveness. Some sarcomas are indolent. They are not very aggressive. Unfortunately, most sarcomas are very aggressive, unfortunately. And sarcomas are being in connective tissue, they're highly vascularized. They have good blood supply. And this makes it easy for them to spread, and the tendency to spread is there in sarcoma, and this worsens the prognosis. Once cancer has spread from the origin, which is the primary site, to a distant site, it becomes difficult to cure. So sarcoma can be cured when caught early. That's when the patient presents as soon as he sees the symptoms and it has not spread, it can be cured. And the mode of treatment, you have 5 major modes of treatment for sarcomas. The 5 major modes are surgery. Surgery is used to excise the lesion, and this is usually feasible when it is early. If it is late, most of the time we won't use surgery because we cannot cure when it's late. That's when it's already advanced, when it has metastasized. We don't often use surgery, even though it's not that we cannot use it at all. but even when we use it that time, it's not meant for cure. Then radiotherapy. Radiotherapy is use of ionizing radiation, like the X-rays, like gamma rays, electron beams, in other climes, proton beams. This ionizing radiation, what it does is to burn the cancer cells. There's a way we apply it that selectively burn the cancer cells. So this ionizing radiation that we do in form of radiotherapy can be used for curative purpose. That's if you catch it early, it's not too gone, you can treat with radiation to cure. Also, we can use it as a form of palliative. It has spread to bones, to other parts of the body, or is bleeding. You can use radiation to stop bleeding, to stop pain, to reduce the size, to improve quality of life in a case that is already advanced. Then chemotherapy is the use of cytotoxic drug for treatment of cancer. The word cytotoxic means it can kill cells. It can kill cells because cancer is cells, it's the abnormal cells. The ordinary drugs, the anti-malaria, the antibiotics and other drugs, they don't kill cells. They regulate cells or kill foreign agents in the body. But cytotoxic drugs can kill cells. However, there's a way we selectively use it. We use it in a way that we can kill cancer cells and save normal cells. It doesn't kill all the cells. It's cancer cells we target with chemotherapy. You can have some side effects, which are usually temporary. But the cancer cells, the aim is to permanently nullify the cancer cells with chemotherapy. And we use it for cancer treatment for sarcomas when we think either a few number of the cells has already spread or it is metastatic, that it has spread. So you need chemotherapy, which is a systemic treatment. You are treating the whole system with chemotherapy. For sarcomas, we don't often use hormone therapy. However, there are other systemic therapy like targeted therapy, which is the fifth one. Targeted therapy, use of monoclonal antibody, use of agent that can modulate growth of cancer cells. We also do that. We use targeted therapy. These are the 5 major modes of treatment.
Thank you, Dr. Habib. I'm sitting down here and I'm thinking, wow. And I always do this. And for all of you just joining us, this is a Kakaki Awareness with Denise Ejok, CEO of Common Cancer Foundation. I'm very fascinated because I always sit down and I'm saying, this is where I am. So all of you, if you've never been on this show before, please do recognize I do live with this disease. Everything is talked about makes sense to me. And as I'm smiling, I still took my chemo this morning. So those of you that run away from chemo, please don't run away from chemo. I'm still taking it and I've been taking it 7 years on and I'm still alive. So don't run away from it. That's my key message. Now, the next question I've got is the role of advocacy in changing the narratives. As you would appreciate, is very, very key. So please tell us 5 facts that are very important because okay, I've just done one. I've just given you one. Me coming out to talk about it is a big thing.
Yes,
we have to talk about it.
Yeah, first on advocacy, we need to educate the populace because, like I said earlier, the prognosis, that's the outcome of the treatment of the disease, is largely influenced by knowledge of the disease by the populace. And like I said earlier, if it is caught early, it is easy to cure. If it is caught late, it becomes very difficult to cure. Screening is very important. We need to screen so that you catch it early because most of the time, sarcomas at early stage does not pose any signs. So it's only if you look for it, that's when you will see it. If you do not look for it, you are not going to see it. Screening is important. Then also, we need to know that treatment, conventional treatment, orthodox treatment is key. Chemotherapy does not kill. It does not kill if it is well applied. So you go to an authentic hospital to see an authentic specialist to give you authentic medication. It doesn't kill. There are many people we know, politicians, even average people that have been treated, some for 20 years, they are with us, living with us. It doesn't kill. Radiation does not kill. It is selectively used. And once you finish treatment, you also need to know that you go for family history to see if there is any risk in the family, if it is running in family. You can also do gene typing. You can do, to check if you have any familiar factor of this, because of the children, because of your sibling, because of the family. If there is any, then we can screen the whole family. Then good diet, exercise. You can modulate all this to reduce the risk of having sarcomas. That's the way you live, your behavior, less alcohol, less cigarette, less exposure to exhaust, and exercise. Exercise is very cheap. When you exercise, you reduce the risk of having cancer because you build your immunity, and it also prevents you from other chronic diseases like the diabetes, the hypertension. Exercise is good for all this. It's a cheap way to do all this.
I do most of them, so I'm very proud. I'm feeling very happy with myself this morning that I'm passing at least some of your checklists to those joining us. Doc, I have a question for you, and it's just very straightforward, very simple. Please share with me 2 takeaways from the awareness campaigns that are key across Nigeria. So it's not today, as I said, is World Head and Neck Cancer Day. Awareness campaigns as we engage the public. So one is for the government, and one is for support groups. So 2 key things that you want us to and help to make a difference, because that's all. This is all about making a difference and changing the narratives for cancer patients across Nigeria. So 2 things that we need to do. Just 2.
One is that thumb up for the awareness you are raising, for the knowledge you are giving the population. We all need to be aware of this. Even those of us that are in health, we need to be reminded that cancer is real. Head and neck cancer is real. If there is anyone that has a persistent nose bleeding, we'll call it epistaxis, persistent ear pain, or nodes, neck nodes, lymph nodes, all this you have to present in the hospital. And for other conditions too, you have to be doing screening. There are regular screening for women, for men. They are screening. We need to do screening because if you catch it early, it will save life. You will be able to knock off the cancer. Then we also we have big organization. There should be corporate social responsibility. They should assist the NGOs to raise awareness, and they should also take part in disseminating the knowledge of screening. And also we should also look for ways to have insurance for treatment of cancer patients, because one of the major drawbacks to cancer treatment is the funding. We pay out of pocket, and cancer treatment I think is even the most expensive form of treatment. I don't think there's any other condition that is as expensive to treat like cancer. So there needs to be a foundation for cancer treatment to elevate the burden of treatment from the masses. Yes.
I want to say a very big thank you to you. You hit a lot of key points for us. To those of you watching us, this is very key. Today is World Cancer Head and Neck, and it's important that if you know family friends that are going through this, they might just need you to give them a hug. It's very key. Dr. Habib, you hit a lot of things, and to the government, please, as they've said, it is key for us. Funding a cancer patient is very expensive. A lot of the time people think that it is cheap, but it is not, or we give up because of the cost. Let us reach out to NGOs. Fantastic job. We appreciate you. To all you doctors out there, we say we appreciate you guys. But to patients, please, if you are going for cancer checks, go and look for what they call an oncologist. That's who they are. The cancer specialist doctors are called oncologists, and they will navigate you through your treatment plan. Thank you all for watching us today. I want to say to you, our next program is going to be talking to another key person, the president of ARCON. ARCON, I think, is the Association for Radiation and
Oncology.
Radiation. Okay, go on, Doc, say it.
Of Nigeria. Association of Residents, Association of Radiation Oncology of Nigeria.
Thank
Association
you.
of Radiation Oncology of Nigeria.
Yes, they are the ones we are going to be interviewing the president, because they have a very big program coming up in September, and I would like everybody to go and look for them on the internet or on their social media page and find out what they are doing and see if you can be part of it and And for those who are survivors, engage with them, because they really need our voices to make a difference and help others that are going through cancer at this time. I want to thank you all for joining us this morning. I want to thank you all for being with us. Together we fight, together we win. Follow us on our social media handles. You can find us on Common Cancer Foundation. We've got an Instagram, and we've even got a new thread. I've posted once on our thread account. We've got it on Facebook. Everywhere you'll find us. Anywhere you look for us. Our email address is CEO at Common Cancer Foundation. I will definitely pick up your messages. Thank you, Doc, for joining me this morning. Thank you for. I know that you have to run off to do other things, but we really appreciate you. Thank you. And to our viewers, we'll see you again in 2 weeks.
Welcome.
When we will have Dr. Amaka Lasebikon. Right? I think I got it. Right?
Yeah.